One of the things that I was really afraid about getting my cancer diagnosis was the thought of being financially flipped upside down. And I just want to say that if you are watching this and that is one of your fears, um, that doesn't need to be the case. And I'm going to kind of walk through in this video financially what it looks like for me, appreciating my blessings, and then also showing you guys how, other people might have had different experiences. So I first want to just let you guys know that, I do work full time, which gives me the ability to be or to have access to really good health insurance. And a lot of people don't have that, accessible insurance like I do. I do work in education. So for me, I just was so blessed to, have really good medical insurance. And I just want to throw that out there before I talk, because this conversation, I guess, might be irrelevant for some people that don't have good health insurance or that don't have health insurance at all. Um, so just want to throw that out there. Now getting into it. Um, I thought at first, that I was going to have to take all of this time off work and just be completely financially turned upside down. I thought my entire savings was going to be completely drained. Like, I was truly afraid of my financial situation, like once I got this diagnosis. I just want to throw that out there that, that's a total valid feeling if you're having that. And I know that a lot of people have that concern. um, and I do also want to say that I never had to go through like traditional chemotherapy, because I'm on targeted therapy, and then I never went through surgery. So, if you're looking for the cost of those things, to be honest, I just don't have the answer for you. This is a video for people that are, wondering, what it's going to possibly potentially cost if you are a metastatic breast cancer survivor like myself, and, continuously living for years with this diagnosis, and, wondering how much it's going to cost. So, um, for me, right off the bat, before I even started my um, cancer treatment, my MRIs that I had, thankfully, again, really good health insurance. I paid $50 for. My PET scans were absolutely free. And I know that for some people that don't have medical insurance, a PET scan can be very expensive. I know, some people are paid like $6,000 for a PET scan. Hopefully that's not the case for you. But I just want to throw that out, that that is some people's reality. My IVF, again, some people pay thousands of dollars for their IVF. I was considered like a medical necessity, so my insurance covered a lot of it. However, the medications for IVFs, there's just so many medications that you have to take for IVF that my deductible for my medical expenses for that ended up being around $300, or $350, which I still think is a deal. Because I know people that were paying a lot of money to have IVF. So, if you are diagnosed with cancer, you can qualify for that under your medical insurance, as a need, like a necessity, if you are young and have not had children yet. Now, after that, um, I chose to do virtual doctor's appointments. And because of that, my doctor's appointments are free. If I were to be going in person, it would cost me, probably like 20 $30 or something, to do my in-person doctor appointments. I also didn't pay any money for my like biopsy. And to be honest, like the ultrasounds and um mammogram is free for sure. My biopsy, I didn't really pay anything for that either. I had a few different biopsies. I had a liver biopsy, and also a breast biopsy. Um, my liver biopsy and my breast biopsy, I don't think that I paid anything for them, but in full transparency, that was a rough time and I don't remember much. So if I paid a deductible, it would have been $50 or less for that. Um, Now, for my actual medications that I'm on, my hormone therapy, which consists of letrozole and Lupron, um, my Lupron is free, so that is monthly and that is free, which is nice. My letrozole is $35, um, about every couple months. I get it in bulk, which is nice. Um, my Ibrance is $35. Um, and that is for 1 month. And then, of course, I pay about $50 in vitamins every couple months as well. Um, so I would say, on average, what I'm spending in a single month is about $70. That's it. And I also have Zometa treatments every 3 months, but again, because of my medical insurance, those are free. So I think $70 is very manageable a month, and it's not something that is going to completely, flip me upside down. Is it an inconvenience? 100%. Is it something that I can manage? Yes, it is. So let me know if you have any questions down in the comment section that maybe I could answer, maybe not. I know that um, some people have to pay a couple $100 like per chemotherapy infusion, which that becomes financially hard for them. As for surgeries and stuff, I just don't unfortunately have a clue on that one. Um, so I am sorry if I don't have that answer for you. I don't plan on doing surgery because I'm not a candidate for surgery. Um, but, anyways, hopefully this video was helpful for you. If anything, it'll give you a little bit of hope. That it's not the end of the world, and financially you'll be okay, even if it might feel like a struggle. I know that when I first took my medical leave from work, I did lose a few $1,000s in pay, um, but thankfully again I had that saved up. So acknowledging my blessing, but also acknowledging that there are a lot of supports, and I would reach out to your social worker who probably knows the different supports that you could get financially for your treatment. There are a lot of community resources that are willing to help, which is really nice. And you also have the right to, you know, your state's medical program as well while you're in this journey. And you also have the right to disability. So take a deep breath and know that it's going to be okay. Bye.